Hi, my name is Letitia, and today it is my privilege to guide you through your supervisor training on supervision and individualized development plans, which are also known as IDPs. The purpose of this policy and procedure is to ensure that as a part of BioQuest Psychiatric and Behavior Solutions, we strive for excellence in meeting Ohio's licensing board requirements and accreditation standards regarding supervision. It is also to ensure that all employees are competent to provide person centered care for all clients. So BPBS will provide supervision to all employees according to licensure board standards and requirements of insurance companies of the clients that we serve. This also includes Ohio Medicaid services provided by practitioners who, under state licensing, require supervision. BPBS requires supervision of all BPBS employees. This comes directly from our policy, BPBS 12.19 supervision. So, in addition, contracted and non full time employees will receive work supervision at least once a month based on their credentials and needs. Let's look at the different types of supervision. So first, we're looking at work supervision. So this is required for all BPBS employees, regardless of their licensure, and it can be provided by any BPBS employee. Now, work supervision, that may occur through the supervisor's participation in treatment or service plan meetings, organizational employee meetings, side-by-side sessions with the client, or one-on-one meetings between the supervisor and the employee. Work supervision work supervision needs are based on the individual and should be practiced as such. Some employees may require weekly sessions, but BPBS standard of practice is for all employees, whether billable or non-billable, to have at the minimum supervision twice a month for at least 30 to 60 minutes. Now let's look at training supervision. So, training supervision is to help clock the hours necessary to meet the requirements of independent licensure. Training supervision will be the employee's responsibility to ensure they are registered with the appropriate board as applicable and that they are receiving the right amount of supervision as identified by their licensure board. Now, training supervision is provided by persons qualified to provide this service as determined by the Counselor, Social Worker, Marriage, and Family Therapist Board of Certification. It is both the supervisor and the supervisee's responsibility to read their respective licensing boards' laws and rules for full understanding of their supervisory requirements. Now, there are multiple types of supervision in addition to work and training supervisions. So, there could be general supervision, direct supervision, group supervision. But whichever type you are going to be having, we want you to refer to the full policy for the definition of each. Now, let's get into supervision agreement forms. So within 30 days of employment, a supervision agreement will be completed and updated anytime through employment for any new supervisor or if you're transitioning to a new position while you are employed here. Each position will have a tailored agreement according to their position within their file. The next few slides will show the different agreement forms, as each form is going to be tailored for that specific discipline. So please take the time to review the agreement form that pertains to your position and the employees that you will be supervising. The first form we see here is the nurse practitioner's form. They will utilize form BPBS 12.19A entitled NP Supervision Agreement. The next one is for nursing. So nurses will use form BPBS 12.19B, Nursing Supervision Agreement. This form here will be utilized for TBS workers. This is form BPBS 12.19C, TBS Supervision Agreement. Therapists will use form BPBS 12.19E, Therapist Work Supervision Agreement. And depending on therapist placement and licensure, that will determine if the document shown here on your screen will be used or not. So if a social worker or counselor is working towards their independent license, you will utilize this agreement form here, Form VPBS 12.19D, Trainee and Licensure Supervision Agreement. For paid clinical supervision and paid training, please refer to Policy and Procedure COR 3.44 entitled Paid Clinical Supervision and Paid Training. Now, all other positions will utilize Form 12.19F, Work Supervision Agreement. This will start the supervision relationship. So please ensure when you have your supervisee sign the agreement form that you have went over the form in great detail so that they understand what is expected of them and what they can expect from you as their supervisor during supervision. Now let's get into the individualized development plan. Now, the individualized development plan, again known as the IDP, that will be completed at the beginning of all supervision relationships between supervisee and supervisor, and it will be updated or reviewed at least annually. For that, you are going to utilize Form BPBS 12.19G, entitled Individual Development Plan IDP. Within 90 days of employment, new hires and or newly promoted employees will have created and reviewed an IDP with their supervisor. It is best to practice the review of the IDP with your supervisor quarterly. However, it must be reviewed and updated annually per policy. A new form will be developed with the employees during their annual performance evaluation. Now, to ensure TBS are meeting regulations, we're going to throw in an additional form. This is Form BPBS 12.19H, TBS Individual Development Plan. So this will be required for the first year of employment to ensure TBS are meeting basic competencies. So this document, it includes all the competencies that are required by the state of Ohio, like ensuring knowledge of the purpose of case management, how to therapeutically engage with clients, and knowledge of crisis response procedures, just to name a few. Now let's look at the different supervision forms. But before we get into the different supervision forms, here is a list of requirements for each supervision. So we're starting off with accuracy of assessment and referral skills, the appropriateness of the treatment or service intervention selected relative to the specific needs of each client, treatment or service effectiveness as reflected by the client meeting goals identified in their person-centered plan, risk factors for suicide and other dangerous high-risk behaviors, issues of ethics, legal aspects of clinical practice, and professional standards, including boundaries, clinical documentation issues identified through ongoing compliance quality records review, cultural competency issues, model fidelity when implementing evidence-based practices, and feedback to personnel that is going to enhance the clinical skills. Now, BPBS provides formalized documents to ensure all areas of growth and regulations are being met. The next few slides are going to show the supervision forms specific to each discipline. So this form here is tailored to the nurse practitioners, their prescribing needs. So nurse practitioners, their supervision will be documented on Form VPBS 12.19I, nurse practitioner supervision. Nursing supervision is tailored to nursing practices. So all nurses are responsible for knowing and practicing within the legal scope of practice as stated of regulation of their RN or their LPN decision-making model guide of their scope of practice. So nurse supervision is going to be documented on Form BPBS 12.19J, nurse supervision. Nursing team leads will complete all 3 pages within the form. Licensed therapists and TBS physicians will utilize Form VPBS 12.19K, therapy and TBS work supervision. And all other VPBS employees will have their supervision documented on Form BPBS 12.19L, Work Supervision. In addition to work supervision, standard of practice also includes having monthly group supervision or team meetings, which would add to the supervision umbrella. So the supervisor will provide team meeting minutes that employees will have access to if they are unable to attend the meeting. So for that, they will utilize Form BPBS 12.19M Meeting Minutes Template. So directors will generally provide topics to go over with all employees. Minimally, you're going to have monthly team meetings, which can include items like company updates, re-education, team building, and more. Now let's look at record and document retention. BPBS supervisors will retain supervision files on SharePoint for each of their employees who receive work and training supervision. Please refer to the Creating Supervision Folders training, and that will give you a step-by-step guide on how to formally set up each folder for your individuals. Supervision documents must be turned in annually to Human Resources. This can be completed at the beginning of the calendar year or at the time of your supervisee's annual performance evaluation. Either one is fine. In addition, upon the end of the supervision relationship or an employee is no longer with BioQuest, the supervision binder will be turned into Human Resources. So this concludes the Supervision and IDP training. Thank you for your attention.